A temporary thrill, a momentary high, and possibly a lifetime of suffering when the situation gets out of hand. Addictions come with a heavy price. Many who have addiction problems suffer alone in silence. They are reluctant to ask for help because of shame, fear, or not knowing where to find help. Some are not even aware that help exists. Addictions can happen to anyone, and it could happen to someone close to you.
I've been drinking for more than 30 years, but it's only been in the last maybe 5 years that it's been becoming more and more of a serious problem. In recent years, I've noted that it has come to adversely affect my relationships with my family members and also to some extent my work situation.
My husband has this gambling problem for 15 years. One time, gamble away in one day my paycheck. I believe that in a marriage, the most important is the trust. And these 15 years, I feel that I'm betrayed. We are all hurt by our loved ones.
Addictions not only wreck the lives of those afflicted, but also affect their families and friends. The social stigma further prevents sufferers from reaching out for help. But there is hope for recovery.
Some people mistakenly believe that addiction is caused by moral weakness or the lack of willpower. But actually, addiction itself is a chronic, progressive disorder in which the person has a loss of control over his activity. Common addictions would be like alcohol and drug use and also gambling addiction.
The Institute of Mental Health launched the Community Addictions Management Program in 2001 to treat behavioral and substance addictions. In 2008, the National Addictions Management Service, or NAMS, was set up to meet increasing demand for specialized treatment.
Addiction is itself a highly treatable disorder. With the appropriate treatment, a person can achieve recovery and also sobriety. And common treatment methods would be using medications and psychological therapy.
NAMS offers inpatient and outpatient services. The Specialist Outpatient Clinic assesses and treats patients with addictive disorders. Patients consult doctors and counselors and undergo individual, group and family therapy.
Some of our patients will voluntarily admit themselves. What we do is we provide medical and psychological support for them. Our patient will go through 1 week of detoxification, followed by 2 weeks of rehabilitation. During the detox phase, we will provide them a safe and secure environment where we help them to relieve their withdrawal symptoms. This is to stabilize their condition for sustained recovery. During the 2 weeks of rehabilitation, we will provide them intensive inpatient program where we will conduct group therapies as well as psychoeducation that covers various topics.
NAMS is committed to caring for the patient as a whole person and not just treating the disorder. Every patient will have a carefully customized treatment plan to overcome the addictions.
You have counselors in NAMS. They teach you in the classroom environment things about what is addiction. For one, I learned to accept that I was an addict.
NAMS provides a comprehensive range of service to help both substance and behavioral addictions. We have a multidisciplinary team that consists of psychiatrists, psychologists, family therapists, and as well as trained addiction counselors. If you need more information about addiction and support, you can call our National Addiction Helpline, which are manned by trained counselors.
NAMS conducts training for healthcare workers and voluntary welfare organizations on identifying and referring individuals with addictions. We also conduct forums and talks to the general public to provide accurate information about addictions and where to seek help.
Here at NAMS, we are the national center in the assessment and treatment of all kinds of addictions. We not only help people who suffer from addictions, we also help their families In addition, we are actively doing research that focuses on our local population to identify trends and patterns and also to evaluate the effectiveness of our addictions treatment.
Our patients can be assured of quality treatment under the care and support of our professional and caring team.
Clients usually believe that they are alone battling addiction. However, that's not true. There's always support available from friends, families, recovery communities, support groups, as well as trained professionals at NAMS.
At NAMS, our patients know that they are not alone in overcoming their addictions. We are committed to providing professional, comprehensive, and customized treatment. But most importantly, we also want our patients to see all of us at NAMS as faces that care.